A real doctor has had a chance to study the charts and the test results after looking at Speaker Pelosi's healthcare reform bill. And Dr. Sreedhar Potarazu of Vital Spring Technologies, author of the book, Get Off the Dime. That's an interesting title. Maybe we should discuss that as well. Doctor, thanks very much for joining us.
Thank you for having me.
You've been through this, and I've got 3 points to raise with you. Number one, is this definitely deficit neutral?
No, the bill cannot be deficit neutral. Number one, they've taken out a big component of how to pay for Medicare prescription drugs as well as the physician reimbursements. That cannot be deficit neutral if they've carved that out. Secondly, the cost for what it's going to take to put in place if in fact we get a public option and all the wiring and all the systems that need to be put in place to help support that cannot make it deficit neutral.
I just have to ask about the public option. Does that mean that the government will set up from scratch an insurance company?
It has to.
Run it. There'll be government employees. They'll set it up. They'll run it. It's a government shop.
That's right.
Really?
And so that takes money, and they haven't factored in the cost of putting in place.
It's not in there?
It's not factored in.
Number two, they propose to take $400 billion, or maybe more, maybe $500 billion, out of Medicare in a 10-year period. If they did that, I don't think they can, but if they did that, what's the impact on doctors like you?
Doctors will ultimately get paid less. Here's what happens, Stuart, and the math is easy. Ultimately, consumers are going to pay more, whether it's Medicare recipients or folks under 65. More people are going to get into the system because now we're providing coverage for the uninsured. Volumes go up. Doctors have to now see more patients, but they aren't adjusting the amount that doctors are getting paid. So ultimately, doctors get paid less, and you and I as consumers get less. So consumers and physicians ultimately stand to lose.
It's never going to happen, though, is it? No politician is going to vote to take $500 billion out of a program that caters to voters. It's not going to happen.
Well, we would hope that it wouldn't happen.
And doctors won't support it, even if they tried to. What doctor is going to say, yeah, beat me, take more off me? It's not going to happen.
I would hope that the physician community will be more proactive now in understanding the implications of this and digging deep into those 1,900 pages and in understanding the implications of what it's going to do to the medical community.
Last one, there is a proposal for states could opt out of the public option. What do you make of that?
More funny math. Interestingly enough, they've lowered the threshold at the poverty level for which people could be eligible for Medicaid, which states support. Now, states will hate the idea of having to pay for more people going into Medicaid. So what are they going to do? Even though they have the ability to opt out, it's going to be cheaper for them for people to go into the public plan.
Right.
So the opt-out is really a means of just disguising the ability for states to gain, and it's very interesting. And the other thing is that premiums in the public plan are actually going to be higher than the private plans, and that's spelled out within the atom bomb that came out of Congress yesterday.
That's an atom bomb? That's an interesting word.
The implications of what's going to land, we won't know for some time, and that's why I call it the atom bomb.
Sreedhar Potarazu, thanks very much for joining us.
Thanks for having me on.